Accurate measurement of blood pressure is crucial for diagnosis and treatment of hypertension. Blood pressure measurement should be performed properly with adequate attention. Measuring blood pressure is one of the first clinical skills taught to medical students, and its importance even today cannot be denied. There is need to ensure that all healthcare professionals should aware of the correct method and the pitfalls in measuring BP. Commonly used sphygmomanometer BP apparatus, auscultatory BP apparatus, semi-automatic BP apparatus, and automatic BP apparatus. The mercury sphygmomanometer is still the gold standard for measurement. There is controversy regarding the accuracy of blood pressure measurement using automated devices. Automated blood pressure monitors seem to provide inaccurate readings in 5 to 15% of people. Automated devices tend to underestimate both systolic and diastolic blood pressure in adults and overestimate both systolic and diastolic pressure in children and adolescents. Accuracy of such automated devices needs to be checked frequently. There is need for regular calibration every 6 months. Office-attended BP, more than 140 mmHg systolic blood pressure and more than 90 mmHg diastolic pressure on several occasions is considered hypertension by Indian guidelines for hypertension. Following points to be considered during BP measurement. Cuff placement and its size. It is well known that using an improper cuff size can lead to an inaccurate BP measurement. Using small cuff can increase systolic blood pressure by 10 mmHg, while large cuff can decrease systolic blood pressure by approximately 4 mmHg. The ideal cuff should have a bladder length that is 80% and a width that is at least 40% of arm circumference. Here on screen, you can see the different cuff sizes according to arm circumference. Now we will see the technique of cuff placement. The lower end of the cuff should be 2 to 3 centimeters above the antecubital fossa. If the cuff is not centered, there is rise of systolic BP by 4 mmHg. Cuff over the clothing raised systolic BP by 5 to 50 mmHg, hence, the cuff should be applied over the bare upper arm. The midpoint of the bladder should be situated over the brachial artery. The usual position is 2 centimeters above elbow crease, fitting snugly, but loose enough to allow 2 fingers between the arm and the cuff. Effect of body position on BP. It is well known that BP varies in the sitting and lying positions. The diastolic pressure is high in sitting position than in the lying position. Systolic pressure is higher in supine position by about 8 mmHg. In the lying position, the arm should be raised with the pillow to come up to the level of the heart. How to measure BP accurately in clinic? The patient should avoid drinking stimulants such as coffee, tobacco or physical activity in the last 30 minutes before coming in. The urinary bladder should preferably be empty. Room environment should be noiseless, quiet. Patient should be sitting with uncrossed legs, resting on firm surface. Back should be supported. The BP must be measured with the arm resting comfortably on a table, supported at the level of the heart. Various factors increasing blood pressure. In this picture, you can see all the necessary prerequisite before measuring the BP. Steps for accurate measurement of BP. Prepare the patient. Relax the patient for at least 5 minutes, no talking during relaxation. No tea, coffee or smoking 30 minutes before BP measurement. Patient's urinary bladder should be empty. Cuff should be applied tightly over skin, not on clothing. Technical part of BP measurement. BP machine must be validated and calibrated periodically. Patient's arm should be supported. Cuff size should be correct. Position of patient's upper arm at the level of midpoint of sternum, that is at heart level. Measurement of BP. At the first visit, record BP in both arms. Use the arm that gives higher reading for subsequent BP measurement. Take 2 to 3 readings at the interval of 5 minutes each. Inflate the cuff 30 mmHg above obliteration of arterial pulse. Deflate the cuff at 2 mmHg per second. Record systolic blood pressure and diastolic blood pressure as appearance and disappearance of choroid cough sound. Note the time of last medication taken. Use an average of more than 2 readings obtained on more than 2 occasions to estimate the level of BP. Now we will discuss about BP measurement in special population. Obese patient. In obese patient, the cuff size is typically small. If an extra large cuff does not fit on arm, BP can be measured on forearm using radial pulse. BP measurement in pregnancy. BP should be measured in seated position either before pregnancy or early in pregnancy to avoid missing chronic hypertension. In lying down position, supine hypertension may result, as the gravid uterus can impair venous return via the inferior vena cava. In normal pregnancy, blood pressure falls in the second trimester and then rises in the third trimester. Use of appropriate cuff size is important. BP should be measured in seating or lying at 45-degree angle with arm at level of the heart. The choroid cough 4 phase is recommended to be used as the measure of diastolic pressure in pregnant women by the WHO. Last but not the least, blood pressure measurement in elderly. Pseudo-hypertension. With increasing age, arteries of the body may get thickened and calcified and may be difficult to compress. They can be palpated beyond the inflated cuff, which is called Osler's sign. Measurement of BP over these arteries may be erroneously high and may result in patient being overdosed for hypertension. In elderly, this can lead to dangerous postural hypertension. An intra-arterial radial artery blood pressure can be obtained for confirmation in such a situation. Orthostatic hypotension. Orthostatic hypotension is defined as a reduction in systolic BP more than 20 mmHg or in diastolic BP more than 10 mmHg within 3 minutes of standing. Elderly patients and those with autonomic dysfunction, for example in diabetic patients, may have underestimated supine hypertension if BP is measured only in the sitting position. BP should be measured at 1 minute and 3 minutes after standing from a seated position in all patients at the time of first evaluation. This is all about BP measurement. Keep watching and subscribe for more.